Hello, everyone. Welcome. I hope everybody is having a wonderful Wednesday. I'm Aura Vasquez, and welcome to my BTH. Today, I have a very special guest and a topic that I have been really wanting to talk about for a while now, which is the response to COVID-19 from New York City. Many of you know that when I first immigrated here to this country with my family, we went to live in New York. So New York is a very special place in my heart where I have a lot of very good close friends that still live there and have been dealing with, with the pandemic. So today I invited my very, very good friend, Patrick Jenkins, and I'm waiting for him to join me on Instagram. When he join us, I'll also bring it here to this chat. And please have your questions ready. I know for a lot of us, we're curious about what's going on in New York and how things are developing. He's somebody that I know since I was in my really young age of my days when I was advocating for is better education for New York City public schools with United Way of New York City. So he is incredible. And actually, he has been also, okay, I think I got him here. Let me bring him on the other side too. He is one. Okay, so I told you about the feedback. It's crazy. Okay, but we got this. Okay, while he gets set up, he's one of the 100th most influential people of New York City. I'm so grateful that he took the time to meet with us and to check in and to tell us what's going on in New York. So please, with no further ado, let me welcome Patrick Jenkins to our live stream. Hi, Patrick. How is it going?
I'm doing great. How are you?
I'm doing good. You know, in LA, things are very different, and the response to COVID-19 from, our elected officials here has been also a little different than in other places. Tell us where you are right now.
Well, I'm in my home in Queens, New York, in Jamaica, right by JFK Airport. For many of you who fly in New York, I'm right near the Van Wyck Expressway. I'm in South Jamaica, Queens.
Wow. And for those of you that don't know, South Jamaica, Queens is a beautiful, thriving, very diverse community, very African-American as well. So I'm so grateful that you were able to join us. I know that you work very closely with Governor Cuomo. Tell us a little bit about your work with him.
Sure. Well, I've been in government and politics since the mid-90s. I won't date myself, but I've worked with him on several occasions, and I had an opportunity when I was working for Congress to step out, and I worked with him when he was at HUD, and while I was in Congress, and then after Congress, I was actually working in my own lobbying, was hired to be his deputy campaign manager. So I was his deputy campaign manager for his first gubernatorial run, and we've had a relationship since. And I think he's doing a good job. I mean, he's been at the front lines, and he's very. You see him every day on the news, and because we are the hardest hit state, but he's on the front lines and doing the best that he can.
Yeah, absolutely. And New York has been the one the bigger urban city that has been hit the most by COVID-19. I feel like you guys were this model city for us to even figure out how to respond and everywhere else in the country. How did you find out about COVID-19? I have other New York friends that some of them were like, I'm leaving New York. They haven't been back since. And some others were like, oh, it's nothing. It's really just conspiracy. So how was your reaction to COVID-19 when it happened, when you first started? When was the first time, actually? Take us through that journey.
Sure. Well, nowadays I represent, I represent CVS Pharmacy. So when it comes to healthcare, I'm pretty much up on things that are happening in healthcare. And we had heard it a little bit at the end of January. And then in February, we started to hear more about it. But New York as a whole really didn't really take hold until maybe the third week in February, third or fourth week in February. And we, immediately took off. But even in my office, I was in my office with my team, and I'll be the first person to admit I first heard about it. I said, look, we're uh, you probably like the flu. My staff was saying I don't want to take the subway, and I'm like, oh, look, it'll be we have to be New York tough. We toughed out.
Yeah.
I'll see you at work the next day. But then, I think it just started to snowball really fast in like third week of February, and then I actually started allowing my staff to stay home. And then in New York, in the beginning of March, they started shutting down things, and they shut down the Capitol and things like that. So really around the end of February, beginning of March, it got to be really, really serious. And you start hearing about people, particularly like in my community, in the Black community, you start hearing about people being affected by it at rapid numbers. It started taking on a life of its own, and then that's when the governor started taking over, and the president actually responded and started talking about the numbers. They started talking about the potential numbers when they started talking about 100. Over millions of people being affected and how many people would die. And so, the beginning of March, it's when everything just started to really snowball,
Yeah, and
New
just
York
get
went
more
into
serious.
action.
I mean, I don't know if this is really true, but I feel like everything got more real after election day, when I feel like I was even worried because some of the people that I know have mentioned that this was coming from China and that this was a real issue. And in fact, I was then still running for office, and some of my supporters wanted me to make that an issue. And I was like, but we don't really have much evidence of what's going on. Like, what is it that I'm going to say? And this is just to speak about the response that in Wuhan and in China they had, that it was so rapidly because it hit them so hard. And in terms of that, how do you think our response from the federal level to you guys in New York, where we have seen videos, disheartening videos about bodies dead and on the floor in basements, or doctors utilizing ponchos to, from all of it we have seen videos about this happening in New York. What do you think? How do you think it's been the response, and why is this happening in New York like this way?
Sure. Well, in New York, one, I think that we have a community that is extremely dense. We have 8 million people that live in New York, but a metropolitan area of close to 20 million people, and we have a huge reliance on our public transportation system, and huge traffic, but about 10 million, over 10 million rides a day on our subway system. People just put into basically a sardine can, riding together, breathing on each other as one big community. And I think that exacerbated our issues here, because honestly, the subway and the railroad is just the main mode of transit on any given workday. The response from the federal government was essentially has been horrible and now becoming very political, which has been a shame, because of just because of the president and his response to it, and Mitch McConnell. When you look at the amount of cases that we have here, and the governor's, put his pride away and has traveled down to DC a couple of times to try and address the issue face to face with the president. But ultimately, their response and Mitch McConnell's response was, we're not going to give relief to blue states or sanctuary cities or other nonsense, instead of just caring about human beings and dealing with the fact that Americans are being affected. This virus doesn't pick political parties, or you could be libertarian, you could be green, you could be Republican or Democrat. This virus is affecting everyone, but the response from Washington has been pretty much horrible. What the governor has done here by setting up the temporary hospitals, by screaming from the rooftops, by putting together organizations. He's done a good job of marshaling forces, taking over state-owned facilities to make sure that they have temporary hospitals, has been an actual excellent thing. We don't, it's come to the point where we don't need them, but at the same time, he's done a good job of setting things up. So we have several makeshift, I shouldn't call them makeshift, temporary hospitals set up at
Yeah.
universities, at the convention center, at racetracks that have not needed to be used. But at the same time, they've increased the amount of testing. New York has had a tremendous amount of testing. Over 880,000 people to date have been tested here, and we are testing more people than anywhere in the world. So the governor's responded in that way.
When do you see, so for example, in California, or at least in Los Angeles, we talk about May 15th to try and figure it out, some sort of returning back to normal. And I don't think we ever going to return to back to normal. I was in New York when 9/11 happened, and I don't even think this is close. I mean, we lost incredible, like it was terrible, of course, and it was heartbreaking, but this is just across the board. It's global. It has affected our economy, has killed millions of people around the world. It's just going to, I mean, it has proven also a lot of different things, that we can work remotely, that we can be effective, that we can do it, and also it has really surfaced the idea of our, the reality of our dilapidated health system, and how, and I think that before we go and blame China and this and that, and we have a terrible rhetoric around immigrants from China, we need to remember that we were the number one country in the world that was unprepared for an emergency. And the reason why we needed to stay home is because we just can't in-house everybody if everybody gets sick.
Exactly.
And that's just a disgrace. But what are you guys, what's the communications around coming back to some sort of normality, or how is New York feeling about returning to open restaurants or so? And I'm also very curious about how public transportation is functioning right now in New York.
Sure. So, well, first off, New York is on pause until May 15th as well.
Mm-hmm.
And it's going to be an interesting thing. What they've done today, actually, just today, the governor announced that 35 counties north of the city will be open, that people can start to resume certain activities that they've named. But May 15th is still the target date, and some of the essential workers will expand to more construction workers and things like that. And I'm not sure if restaurants and things like that will be ready to open on May 15th, but that is the target date. I do think that we've had a series of days, a number of days that we've seen a decline in hospitalizations and in deaths. So I think that if we do have that steady decline for 14 days, that we will look towards opening up pretty slowly with new rules in place. Now, what we're talking about is a new normal that's going to exist for everything.
Yeah.
How restaurant capacity, public transportation capacity, all kinds of things dealing with people coming together and being together in one place. Until we have something like a real vaccine, I think we'll have a new normal. Remote working will become way more normal than it was. I mean, even for my company, it's, I'm kind of, considering not returning to an office space and having my staff work remotely. I think it's been somewhat effective, although I think I'll figure out some way for us to come together in person periodically. But I think remote work will be different. And then the subways have been operating, and I think that they've been operating on certain schedules. Now, the homeless, what we've done here in New York is we've had a stay in place order for everyone, 100%. Only essential workers go to work. So the trains have been running. We've had a tremendous, devastating effect on our MTA workers, on our first line workers who've been doing it. They've had a number of infections and deaths with our MTA workers. It's been tragic, and we need to do everything we can to show them support. But I think the pause lasts until 15th. That we heard today from Dr. Fauci about the drug that they've been testing proves out to be true. Maybe that could be helpful. But everyone's looking towards May 15th, especially above the city, to see what happens. The density of the city may dictate some different norms for us.
Absolutely. And so it's interesting to hear you talk about the public transit, because in LA, there is a huge effort to make our public transit more robust and better, because we have a very crappy not so great public transit. And it's sad because public transit is used at least in LA, for more of the low income working class people. In New York, it's a little different. You go out at 7 in the morning, you see everybody in the subway, rich, poor, important, educated or not, But in LA, it's a little bit different. And it's such an equity issue, at least here with transportation, because a lot of those folks that take transit are cleaning folks, people that work in gardens, and that they have not been able to, so all that economy that has not been able to stop, even with the regulations, because of the nature of their work, so we have seen a lot of cases flourishing in the African American community and in the Latino community here, because they couldn't stop, because there is no safety net, for that. So I mean, I know that in New York, again, it's a little different, the way that you guys approach public transit. And my hope is that this is not going to stop public transit from being something attractive to cities, but it's going to bring more. But I wanted to mention that because yesterday I had folks from the Black Lives Matter speaking to us about their demands that they have for Black and for brown people, to make sure that this is not just a bailout for Wall Street, but it's also something that it can, help all of us. So I guess in the economic question around COVID-19, what are some of the effects that you have seen in your clients that are, a lot of them are elected officials, are companies, and in your own company that you're some small business owner,
Exactly. And still waiting for that PPP, because I'm doing everything I can to not lay off any staff. I want everyone to stay on board and ride this out. And even if I have to do what I can, I mean, taking out some loans and things like that to try and be helpful. And I think that ultimately what I've seen in the community, what we really see is the disparity in healthcare delivery and access here in our communities. And not only that, I've heard several stories from people in my community. I'm also a party official here in Queens. I'm a district leader, and I speak to a lot of the residents here about what's going on with them. And I'm involved in a lot of town hall meetings and things like that here locally. And what I found is doctors treat us differently and don't believe us when we say to them that we're sick or that we have an issue. And what we found is that a lot of people went to the doctor 2, 3, 4 times before being taken seriously and getting the tests that they need. And if they didn't have the right kind of advocacy, they might have been turned away. And that's affected some of the mortality rates. So I think that what we've seen, the infrastructure in New York, we had a commission maybe about 10 years ago that started shutting down hospitals and shutting down, the Burger Commission here started shutting down hospitals and access to healthcare. At the same time, hospitals were buying up community practices. And what we found is that over 50% of the people in New York don't have a primary care physician and use the emergency room or urgent care as their first line of defense. And mostly the emergency room, especially if they don't have insurance or access to Medicaid.
Right.
And it's really affected our communities in that way. It's just brought that to light in a tragic way that people who don't have equal access to healthcare, who don't have access to quality healthcare, are being dramatically affected by this. And I think the density hurts us, because I think the same could be said for rural communities that have basically physician deserts in the upstate. But because they don't have the density we have, we don't see the same numbers.
Yeah, absolutely. And I'm getting a question from Facebook, somebody asking, how does life have changed for minimum wage workers? And I think that they're the most affected. Why? Because the $1,200 stimulus check has not gone to some people, but has gone to people that have passed away. We've seen the reports in the news. So, I mean, the reality is that in California, we live in one of the most expensive states, New York too, to live out of, I mean, I don't know if you guys release extra funds for unemployment, but to live out of $400 or $500 a week pay for unemployment, I don't know who can do that. I just don't know. So how is life has changed for minimum wage workers in New York? If
Sure.
you
Well,
can maybe share a little what you know.
In New York State, we've tried to they've tried to address this issue by offering, on top of national unemployment insurance, additional unemployment insurance in New York. In fact, if you're a minimum wage, you might come out better with the extra $600 a week in New York if you get it. But that's what they're saying, and it's going to be retroactive to the time that you were laid off. But it changes dramatically. I think that one of the things that we've been calling for, in terms of universal health care, and whether that's Medicare for all or single payer, it's been part of the. But I think now this crisis calls out for something that wraps around everyone, and I think that we have to get out of that, what I call sometimes the silly season, the election season. Even though I've run campaigns and work on campaigns, we have to get to the table and talk about the things that we're going to need, particularly for minimum wage workers. I mean, in New York, we've raised the minimum wage to $15 an hour here, but that's not nationwide. And of course, there are some people who are taking their time to get there, and tip workers and tip wage workers who are working in restaurants. It's going to dramatically change. It's going to take time for us to get up to speed. I mean, that's why you see 22 million people applying for going into unemployment roles.
Yeah.
The country. So, yeah, I think life is going to change, not just for everyone, but for minimum wage workers. We're going to see how this dramatically affected their lives, and hopefully, I'm trying to be hopeful throughout this process, and I'm hopeful that more people's eyes have been opened to the plight of the and not those folks in Washington who live in a bubble, who live in the Beltway, who have a different perspective on life, but normal people. When I see what the governor of Michigan is doing, what your governor's doing, what my governor's doing, I think that a lot of people who are influential, who are of better means, are seeing the effect that it's having on society as a whole. And when you look at, the governor has put together in New York a task force of a recovery task force that speaks to all walks of life around this city, around the state. And I think hopefully that those people will come together and talk about life in New York post May 15th in a very positive and compassionate way.
Yeah, and I totally agree with you. I'm fearful myself. I have never been fearful about being sick personally. I just don't feel it in my heart, or maybe because I've been quarantining now for a while. But I'm definitely scared of what's going to happen to our economy. Very different than Wall Street, but what's going to happen to our economy and how we're going to be able to find work or get our businesses back and running. You're a consultant, I'm a consultant. Some folks are asking, the approach to election season. And I wanted to ask you, how do you see folks that are running for office treating this situation? Like, how are we campaigning now? This is really, sure. We're going back to digital all the way. And I have been on the tip of digital for a really long time myself. Right. So I'm familiar. But there's a lot of candidates that are not, that's not how they're being built. And the reality also is we have, and I spoke to this with the LA Times at some point when I was still running for office, about mailers and how, they're unsustainable. But sometimes that's the only way that you have to go out there and communicate with people, especially if you have a very large district.
Right.
So I'm assuming that that's going to get ramped up, more mail and more ads and calls, and all that, doing it remotely. But what's going to happen also with the grassroots candidates that don't have the infrastructure and the money to buy the tax program and and do it with the mail, which is so expensive? What is your, what are so? I want to first talk about candidates, and then we can talk about elections, because I have a few other questions for you.
Sure. So I think that for candidates per se, I think you're right. I think that the digital age is upon us. And I think some of the old tried and true traditional methods will matter as well. And that's going to the regular phone and picking up the phone and calling folks. But also this kind of technology where, I've been on a few Zoom calls today, and I have to tip my hat to the elected officials that represent me, from the congressman on down the level. They've been on top of this virtually. New York City Council is actually holding its meetings virtually on Zoom.
Yeah. Yeah, we are too.
And I just got off just before you. There was a town hall meeting on education with the state elected officials from this district that included the chancellor of the SUNY system, of the Board of Regents, that included people from the Department of Education. So I think people are getting up to speed on this new normal pretty fast. And the question is, do we have the technology in the hands of regular people that can access this information at the time that they need it? I think that candidates are going to have to. Now, I will say this: my mailman has been tremendous too. He's been out every day, and he's seeing me every day because I'm home now. So regular mail, but technology, virtual, and then robocalls. And we've done something here in my area as well, which has been working with seniors. We've been calling seniors, doing wellness checks. And the seniors are getting up to speed and getting the technology as well. So, I've been assigned some seniors. I've been calling seniors, asking them if they have enough food, if someone's calling them every day, because the senior centers are closed down. So it's those kind of things. It is a new normal. Again, I'm of an optimist bent, so I want to say that we'll get used to this new normal in a way, but also once we're able to get out and about, we'll do that again. But I do think our schools have been, they've handed out over 250,000 tablets to students so that they could access their work. I don't know how remote education is going just yet. I think it's too early to tell, but maybe it's something that we need to look at in the future. I always had a problem with our agrarian structure in our school system, 9 to 3, summers off. I mean, I think we need to be a little more innovative and maybe talk about extending the school day, extending the school year, working with parents who have different work schedules, those kind of things. So yes, I think we have a lot of questions coming out, but I think we should be optimistic and future thinking about how this will affect life going forward.
Yeah, and change. I think change and adaptation is the name of the game right now. And I definitely see how, for the younger candidates, this might be a little different. They might be more already utilizing social media and other things. And I can see how this can be a game changer for a grassroots candidate versus a much more established candidate. I'm curious, and I'm also curious about how elections are going to look like in November. A lot of states are now talking about apps and being able to, if we can use our banks this way, if we can now call the doctors this way. Some folks are very skeptical about this because we have evidence that, for example, other countries like Russia have intervened in our local elections. So how this is going to look like, but what are some of the things that New York have done to anticipate the changes and the fact that maybe we're not going to be able to go to the polls?
Sure. Well, New York has already made a determination that they will be sending out absentee ballot applications to every single registered voter. And then you can vote by mail it used to be in New York that you needed to have an excuse. I know California, in fact, I've learned from some of your greatest, Stevie Barra, God rest his soul, Dan Chavez out in California. Those guys were doing vote by mail for 2 decades now. But here in New York, getting vote by mail done is one way. And then also, look, I'm a proponent of mobile voting. I know that there's a couple of tests going on around the country. A friend of mine, Bradley Tufts, is doing some great things around mobile voting. I think we need to dive head first into some of these things and not be afraid and deal with the problems. I don't want to be stuck in inertia, by inertia of worry. I think we need to dive in, give it a shot, give it a try, and figure out the kinks and make it solid and make it and give it all the security it needs. But we shouldn't be shy in diving into these things and giving things a shot.
Yeah, definitely. I mean, I know that in California, we're testing out. Also, everybody's going to get a mail-in ballot, so you don't have to go to the polls. I think we should have done this a long time ago, to be honest. The same with, I think, all of our governmental, meetings and agencies should stream their meetings also on social media. A lot of people are just there. It's such a hustle, and in LA, the city council is meeting with it's meeting virtually through Zoom, and that's great. But I think we should make it a complete full access. They should stream these meetings across platforms that you can like simply like hear where I'm seeing all of my comments and questions on on Facebook, on Instagram, on Twitter. I mean, I can see the whole thing here. I think the city council should be able to do that, and maybe it took a pandemic for us to change our rules. I know that it has a lot to do with the Brown Act, which is like, where are we meeting? How are we meeting? For
Right.
some of us that have been in the public service. But also, I think it's time for us to completely modernize and make sure that we all go all the way and also stream these public meetings on social media. Just like the White
Correct.
House does it, just like other places does it. I think everybody should have access to their local electeds at their tip of their hands. We pay
Right.
taxes. I mean, that's just how I feel. I don't know how you feel about that.
Well, in New York, we're a little bit ahead of the curve. All of our city council meetings are streamed. All of our committee meetings and state legislative sessions are streamed. So we do have that kind of open access. Um, it's not interactive, and maybe it shouldn't be. I just think maybe it shouldn't be, but I do think we're getting to that point. But I do think we should look at a few other things. I mean, we hold out elections in November. Part of the things that we need to be able to do, like in New York, we're having our primary is in June, and then the general election is in November. Now, if we can push that up, like then we can check on double checking ballots and making sure that the vote was counted properly. One of the things about having it in November, it's really, a 7-week time. And then when you think of the holiday season, that's really more condensed on counting votes and making sure that things were done properly. So now if we do it maybe in September, then you have more lead time, and maybe you do have a lame duck. But at the same time, and we should make rules for one person in office. But having Trump be a lame duck in September, I think we'd all be happy about that if we could. But but at the same time, I know that there's some rhyme and reason, but these are the types of things that we should be discussing as a country. There's been things like national popular votes and getting rid of the electoral college. So one of these things when you have, we've never had anything like this, but I remember 9/11 in the same way. These are the times to make innovative decisions and really, really make an assessment of how we do things. And maybe we can change how we do some of these things.
Absolutely. We need to get to 2020, you all. And maybe it took a pandemic. I mean, we have rules even here in California and in LA, where elected officials can meet because Brown Act virtually. I'm like, guys, this is the way we headed. We need to really take advantage of this moment and revise and really see what's really working for us and what's not. So I'm glad to see that there is some movement out there to try to start getting more modernized and more up to speed. I wanna just end our conversation by asking you, what is keeping you up at night? Are you worried? Are you worried about what's going on?
Yeah, I think naturally, I think there's a few things. I worry about my grandma. She's 102, and I haven't been able to go see her because of it. And I'm an asthmatic. I'm less worried. I'm more worried about my team and being able to keep the company together for the long haul. With the economy the way it is, and understanding, I look at nonprofits that are suffering, and these budgets are going to be thrown out of whack. I mean, you look at what's going to happen with donations from different folks. I mean, one of my organizations had a virtual gala last night, 2 nights ago,
Right.
to address the need. So we're going to have to restart some things, and the only thing I worry about, I think we'll be fine and resilient and come through it. I'm hopeful that we can hold it together until that's there. The mental health of folks, I think, is very important. I mean, I was talking about mental health before this happened, and even my need. I'm not a big sleeper, so even my need to learn to meditate, and I've been procrastinating on meditation, which is hilarious. But but I think that I do think that this has actually helped focus on uh, people's mental health and the role it plays in our everyday life. And I've heard things about the work-life balance and how people need that. I think this episode has brought all of that to light, and hopefully the helpful spirit that I see, and also the focus on healthcare, the focus on mental health, the focus on our seniors who need, and how this has devastated our seniors. I'm hopeful, but of course I'm cautiously optimistic in
Yeah.
terms of how we get through this, and I'm hopeful that this doesn't go for 18 months like they're talking about for a cure.
I know, me too. And, definitely my heart goes out to you and to all of my New York friends and to all of the New York City community that is going through so much. We're sending you so much love and good vibes, and things will
Same
work
here
out.
from New York. Same here. I got peeps in LA. Some of my folks out there at Mercury, and I had a couple of nurses out there, friends who went to school with me. So I'm hopeful for you guys as well. And let's just stay in touch and try to bring the country together 3,000 miles apart.
Absolutely. And, we should definitely have you back in a few weeks to see how things are holding up. I really hope that in a couple of weeks, we're going to see just like completely flatten the curve. And we have a lot more other curves to flatten now from now on. But thank you so much for all that you're doing out there, sending you so much love. And I hope that you have a great afternoon. We'll talk very soon.
You too. Have a great afternoon. It's evening here. Take it easy.
All right. Bye-bye.
All right. Bye-bye.
All right, friends. So thank you so much for joining me today. We have Patrick Jenkins just talk about, what's going on in New York from his perspective as a community leader, and also as someone that has a consulting business that works with so many candidates and with so many other people in government. My New Yorkers, I'm sending you so much love, and I'm here for you. Tomorrow, I'm going to have another guest, Elena Pop. She's an attorney that specializes on tenants' rights. I mean, this weekend is pay day. So we have to make sure that for those of us that can pay, or for those of us that cannot pay, we know what our rights are and the things that we can do. So if you have a friend, or if you love my talks, please send it to them and make sure that they get this information so that tomorrow they can get the information that they need. So I see you guys all tomorrow at 3 p.m. Stay encouraged, and we'll talk very soon. Have a great day. Bye.